Okay, hello. My name is Jacob Pomares. I'm a student physical therapist assistant. Today we're going to be talking about autonomic dysreflexia and pressure relief techniques. So initially, AD, what is autonomic dysreflexia? It is going to be your body's protective response to any noxious stimuli below T6. So this is going to affect individuals with spinal cord injuries with T6 and above. So what that does is any noxious stimuli that's detected by the body, your body's going to go into this emergency response. And essentially what's going to happen is you're looking for that noxious stimuli, whether it's a kinked catheter causing urinary bladder distension. It could be anything from like a rock in your shoe or some sharp object in your shoe, right? Any sort of noxious stimuli you want to check, make sure is anything too tight. What you want to look out for is these signs and symptoms. So severe headache, red flushed skin, sweating above the shoulders, blurry vision, elevated blood pressure. And what you really want to do to take action against this is, first thing I would do, call for help, call for the nurse, anybody that's nearby to help you assist. Avoid laying down. You want to stay upright so that head is above the heart. You want to decrease that blood pressure, which is really important. Loosen any tight clothing, or even if you have to, remove clothing. Really look out for those signs and symptoms, because that's going to be the biggest factor of identifying AD and stopping it as soon as you can. Now, in terms of pressure relief, spinal cord injury people or individuals with C7 and C8, you guys still have tricep use. So what you can do is externally rotate, and you can depress so that you're removing pressure off your ischial tuberosity in your sacral. You want to do pressure relief every 15 minutes. And then for every technique, you can do it for 30 seconds to a minute, depending on what it is. One of my favorite ones is if you're a C6. Hook to one side, hook to the other, and you're gonna relieve pressure off your ischial and your sacral. Hold that for 30 seconds to a minute, and then switch to the other side. Beautiful, right? And then like that initial one, if you have your triceps still intact, you can also, it's not high enough, but the idea is you'll depress into the seat so that your ischial and your sacral are offloaded. Now, for C6, you can also go to an elevated surface like a bed, right here. You can offload here. Same thing, 30 seconds to a minute, and you want a total of 2 minutes for pressure relief. If you have your leg rests in place, you can do this for C7 and C8. Lean forward and offload that weight off your ischial and your sacral, right there. Yep, that feels real good. And again, total of 2 minutes every 15 minutes. You can split it up between minute to a minute or 30-second intervals. Thank you.